Okay. Does anybody use melatonin? Okay. You know, I take melatonin certainly for sleep. Very, very interesting. When I was 30 last year, I took, it was funnier than that, but I remember taking 3 milligrams of melatonin, and I couldn't get off the couch the whole next day. I mean, I was just zonked. Now I laugh at 3 milligrams. I take 12 milligrams at bedtime, and sometimes it does the job. But the good thing is melatonin is a powerful, now here's the thing, it's a powerful antioxidant in prevention, but through multiple mechanisms, it interferes with the proliferation of cancer. I think every study I've read on melatonin and cancer has been out of Italy, and I think his name is Lasoni. I'm trying to remember. I think it's Lasoni. But most of the studies showed increased survival of every cancer. And you may have heard, this is going years back, about the studies published out of Italy where they took pineal glands from mice or rats and transplanted them. Do you guys read that? What they did is they took an old group of mice and a young group of mice and transplanted pineal glands. And the old mice started looking young, increased activity, fur started looking younger, and the young mice started aging very quickly. So melatonin, certainly the pineal gland calcifies, which doesn't explain this with age, but melatonin secretion clearly decreases with age, while cortisol, unfortunately, tends to increase, certainly doesn't usually fall unless you're Addisonian or anyway, having adrenal insufficiency. And that balance is very, very important. So anyway, so melatonin is exciting. It blocks metabolism of linoleic acid, which is important for cancer cell proliferation. Certainly remember the omega-6 fatty acids we talked about, going to arachidonic acid and going down the COX-2 pathway versus the LOX pathway. Interferes with the activation of estrogen receptor by estradiol. Has anybody ever noticed, everybody here is doing bioidentical hormone replacement therapy? You ever notice you start someone on high dose, I don't know if you've ever done this, start someone on high dose melatonin who's on estrogen getting hot flashes? You may occasionally see that. Certainly I have seen that. And, your estrogen levels are unchanged, but it's competing with melatonin for binding to receptors, estrogen receptors. Speaking of that, you may have heard of the nurses study. Nurses working night shift have, in a large study, had increased incidence of breast cancer. And of course, less melatonin being secreted, that means stronger or more binding of estradiol to the estrogen receptor. Melatonin inhibits telomerase activity in cancer cells. It promotes apoptosis. And I will get into a little bit with telomeres and telomerase a little later. As a matter of fact, I'm going to remind myself. Okay. Also antioxidant protocol. Okay. Stimulates cytotoxic activity by activating macrophages and monocytes. We talked about the importance of them. Summary of the statistically significant studies using melatonin. 63 patients with non-small cell lung cancer randomized to 10 milligrams melatonin or placebo. 5-year survival was 6% in the treated group versus 1% in placebo group, and once again reached statistical significance. 30 patients with glioblastoma and treated with radiotherapy randomized to 10 milligrams melatonin or placebo. 5-year survival was 43% in the treated group versus less than 1% in the placebo group. 14 patients, small study, 14 patients with metastatic breast cancer and treated with tamoxifen, randomized to 20 milligrams melatonin or placebo. 5-year survival was 64% in the treated group versus 36% in the placebo. 50 patients with brain mets of multiple primary and treated with radiotherapy, randomized to 20 milligrams melatonin or placebo. 5-year survival was 38% in the treated group versus 12% in placebo. 50 patients with metastatic colorectal cancer treated with interleukin-2, and this is out of Europe, randomized to 40 milligrams melatonin or placebo. 5-year survival, 36% in the treated group, 12% in placebo. 60 patients with metastatic non-small cell lung cancer treated with interleukin-2 randomized to 40 milligrams melatonin or placebo. 5-year survival was 24% in treated versus 19% in placebo. So how much melatonin do you use? Most of the studies, I'll tell you, I mean, all the studies, they use 10 milligrams, 20 milligrams, 30 milligrams, 40 milligrams. I think I found one study using more than 40 milligrams. What I do is I use 20 milligrams. I would use at least 20 milligrams. Does it hurt if you use 30 or 40? No, it doesn't. And has anybody gone to high doses? It doesn't cause any problems. What's that? Yeah, that actually, yeah. So maybe sometimes in the first couple of days people are really sleepy, but that goes away very quickly. And so, you know, the drowsiness is not an issue. And actually, you know what, the 10-year-old boy, the 10-year-old boy that I'm being consulted on, he's on high-dose melatonin, and interestingly, that goes away in a few days, the sleepiness. So without question, every single one of my stage 3, stage 4 cancer patients, I put them all on 20 milligrams melatonin. I would use anywhere between 20 and 40. Absolutely. And you know, of course, you know, besides the fact we talk about platelets do play an integral role in adhesion and metastasis. You know what? Personally, I don't care if you've got a good product that is well absorbed orally. That's fine. I use the sublingual, but you know, the bottom line is if you get great absorption, get great absorption. I don't have a preference. Now, you know, you can obviously measure, if you're really questioning, you can measure levels of melatonin, but you know, there are some sublingual products that are no good. But yeah, that's fine.
So for the non-cancer patient, if you want to take it for preventive, what's a good dose, and is there a problem taking it long-term?
No, once again, we have not seen any problems long-term, and I'm confident enough looking at the literature. I mean, God, I've been taking it for many years, and you know, I'm going to take it, you know, indefinitely. Now, what is the best dose preventatively? I don't know the answer to that. You know, once again, it's a powerful antioxidant, so you know, it'd be nice to see a prospective study. You know, 10 versus 15 versus 20. I don't know the answer. I'm taking 12 only for sleep now, and I have my issues with not sleeping. I have a very bad back from trauma, so I get woken up with pain a lot, and I'm really just medicating for my sleep issues. But I don't know the best preventative dose. What I will do, let's see. Okay, we'll come back to this at the end. Vitamin K2 and cancer. Now, I'm going to talk about vitamin K2, but I'm going to tell you that I'm no longer using vitamin K2 for cancer, even though vitamin K2 is wonderful. And that's only because I'm giving vitamin K3 both IV and orally. Remember I told you about Tom Miller, who's got a patent on Apatone, which is vitamin C and K3 orally? And vitamin K3 gets reduced to vitamin K2, so I'm not giving vitamin K2 separately because I'm giving it in the vitamin K3. And I need to give you this information. Oral vitamin C and K3 can be ordered from a compounding pharmacy called Strasburg Pharmacy, S-T-R-A-S-B-U-R-G, and I believe they're in Ohio. If you Google Strasburg Pharmacy in Ohio, and tell them you want vitamin C K3. Every one of my cancer patients takes 5 capsules 2 times a day. And they're standard. They're all made 500 milligrams of vitamin C with 5 milligrams of K3. If you call there, they'll make that up for you. So vitamin K2 is great, but I don't need it because I'm getting K3.